Welcome back to my channel. And if you are visiting this space for the first time, you're also highly welcome. In this lecture, we'll be looking at differences between the deep and the superficial perineal pouches. We will be summarizing the differences between the deep and the superficial perineal pouches. For this slide, we would be highlighting the differences between the deep and the superficial perineal pouches. And this slide will be focusing on the orientation of these two pouches. If we try to use this image by the side here, this is where we have the pelvic cavity. And we already described in our previous lecture that the pelvic cavity is limited inferiorly by the pelvic floor or the pelvic diaphragm. This is what is seen to be highlighted here in purple. We say that inferior to the pelvic floor, the pelvic diaphragm is where we have the perineum, and this is what is carved out here in this region. We also illustrated in our previous lecture that the perineum is further subdivided into two triangles, and the demarcation is created at this point that is highlighted here in dotted black. We say that in the anterior part, we have the anteriorly placed urogenital triangle, while posteriorly, we have the anal triangle. It is within the anteriorly placed urogenital triangle that we have both the deep and also the superficial perineal pouches. So if you look at this anterior region within the perineum, this is where we have the deep perineal pouch, and this is what is highlighted or harrowed here in green, while more inferiorly or more superficially, we have the superficial perineal pouch. So we can say that the deep perineal pouch is located deep within the perineal space, while the superficial perineal pouch is located superficially within the perineal space, just as the name implies. If you also drive further, you see that this deep perineal pouch is located between the superior and the inferior fascia of urogenital diaphragm. If you look at this structure that is highlighted here in green, this is what is referred to as the urogenital diaphragm. If you go through our lecture on the deep perineal pouch, we illustrated in that lecture that the deep perineal pouch can literally translate to the urogenital diaphragm, which means that it can be taken also as the urogenital diaphragm. So this is the urogenital diaphragm here that is highlighted here in green. We also stated in that lecture that the urogenital diaphragm is a collection of muscles, just as what is presented by the pelvic diaphragm or the pelvic floor. So this is the urogenital diaphragm here that is highlighted here in green. This urogenital diaphragm is superiorly covered by the superior fascia of the urogenital diaphragm. And this is what is harrowed here in yellow. Also inferiorly, this urogenital diaphragm is also inferiorly padded by the inferior fascia of the urogenital diaphragm. And this is what is seen to be harrowed here in red. So we say that the deep perineal pouch is located between the superior fascia of the urogenital diaphragm and also the inferior fascia of the urogenital diaphragm. Of course, the structure that is then contained within this space is the urogenital diaphragm. So this structure here at this point is referred to or tagged the deep perineal pouch. So if you go to the superficial perineal pouch, you see that the superficial perineal pouch is then located between the inferior fascia of the urogenital diaphragm, and this is what is harrowed here in red. This can also be taken as a perineal membrane, and it is located between this fascia and also the Cole's fascia. And this is the Cole's fascia here that is harrowed here at this point. So between these two fascia, which include the inferior fascia of the urogenital diaphragm and also the Cole's fascia, is where we have the superficial perineal pouch. Also to add that if you go back to the configuration of the deep perineal pouch, you see that the deep perineal pouch does not represent a true configuration of a pouch. You see that the deep perineal pouch can also be taken as the urogenital diaphragm, and it's not seen to present a configuration of what a true pouch represents. While the superficial perineal pouch down here that is harrowed at this point has a true presentation of a pouch. Also to add that the deep perineal pouch is a closed pouch. If you go back to this image up here, this is where we say we have the deep perineal pouch that is harrowed here in green. If you look at it on the anterior side, you see that it is closed. And if you go behind here at the posterior region, you see that it is also closed. So it is a closed pouch. And if you try to compare this configuration with the superficial perineal pouch down here, you see that the superficial perineal pouch is just closed posteriorly, while anteriorly at this region, it is opened. So you see that the superficial perineal pouch is an opened pouch. If you try to compare this configuration with the deep perineal pouch. So these are the differences as we have highlighted concerning the configuration of the deep and also the superficial perineal pouch. So let's drive further. We'll be using this slide to describe the viscerals that are contained within the deep and also the superficial perineal pouch. So let's try and use this image up here to illustrate the specific regions of the urethra that will be seen within these two pouches. This region up here is where we have the pelvic cavity. We know that within the pelvic cavity, we have the urinary bladder in both the male and the female. The urinary bladder is a site where urine is temporarily stored before the need to release it out of the body will arise, and this will be released through the urethra. So we have the urethra here extending from the urinary bladder down here, of course, leading to the external environment. The configuration of the urethra in both the male and the female are different because of the peculiarity of the reproductive system. So if you look at this image, this is where we say we have the deep perineal pouch, and inferiorly around the superficial region, we have the superficial perineal pouch. So if you look at the course through which the urethra runs, you see that there are specific regions of the urethra that will be running through the pouches at different points. Also, it's good that we had that the prostate gland is located around the urethra, just around its exit point from the urinary bladder. And this is what is saying to be highlighted here in yellow. So we have the prostate gland around this region. So if we go back to the alignment or the sub-regions of the urethra, you see that this region that is harrowed there at this point is an initial point of the urethra or region of the urethra before it pierces or it passes through the prostate gland. And this is referred to as the pre-prostatic urethra, just as the name implies, the region of the urethra that is seen before the prostate gland. Then after this region, the next region of the urethra will be the prostatic urethra, and this is what is seen to be harrowed here in yellow. The prostatic urethra, just as the name implies, is the sub-region of the urethra that is seen to run through the prostate gland. And after this region, the next region is the membranous urethra, and this is what is harrowed here at this point. If you look deep into the membranous urethra, you see that this membranous urethra is seen to pass through the deep perineal pouch. Remember, this configuration here is the deep perineal pouch. So it is the membranous region of the urethra in male that is seen to pass through the deep perineal pouch. And if you go more inferiorly, the next region after the membranous urethra is the spongy or the penile urethra. And this is what is harrowed here in black. You see that it is the spongy or the penile part of the urethra in male that is seen to also pass through the superficial perineal pouch. So you see that as the urethra runs along its length, you see that specific regions of the urethra are seen to course through the deep and the superficial perineal pouch. And this is what we've used this image to illustrate. So if you use this lower image here, this image here is a superficial perineal pouch. The deep perineal pouch is not seen in this image because it is located deep to this space that is projected. So we can imagine that it will be the superior part of the urethra that will be positioned within the deep perineal pouch, while the superficial perineal pouch, which is this region that is exposed in this image, will be seen with the inferior region of the urethra. And this is what is seen to be harrowed here. So you see the urethra here, of course, the lower region will be seen within the superficial perineal pouch. Also, in addition to the urethra in female, we also have the vaginal canal. It is also the superior part of the vaginal canal that will be seen to be positioned within the deep perineal pouch, while the inferior region of the vaginal canal will be seen within the superficial perineal pouch, and this is understandable. So you see the inferior part of the urethra opened into the superficial perineal pouch, and this is what is harrowed at this point. So this is distinct for just the female because we do not have vagina in male, so this is just specific to the female. So in addition to the urethra, you also have the vaginal canal, and it's good for us to be able to establish the specific regions of the urethra and also the vagina that are seen within the deep and the superficial perineal pouches. Also, to add to the viscerals, we also have glands. If we try to use this image up here, this is where we say we have the deep perineal pouch. Within the deep perineal pouch in male, we have a gland that is referred to as the bulbourethral gland. And this is what is highlighted here in yellow. You have one on this side and you have another one on the other side. You see that this bulbourethral gland is positioned on both sides of the membranous urethra. So it is located within the deep perineal pouch. And remember, we said that the membranous urethra is the region of the urethra that is seen to pass through the deep perineal pouch. So if this region is located within the deep perineal pouch, and we also have these glands located on both sides of this sub-regions, it means these glands will also be positioned within the deep perineal pouch. So you have the bulbourethral glands, which are basically known to secrete the pre-ejaculate that is released into the internal wall of the urethra, which helps, of course, to cleanse or lubricate the internal wall of the urethra in male before the normal ejaculate is released. You see that in the superficial perineal pouch in male, we do not have glands. What you have in the superficial perineal pouch in male as it relates to gland is the dot of the bulbourethral gland, and this is what is also highlighted here in yellow. So you see the dots extending into the superficial perineal pouch, releasing the secrets of the gland into the internal wall of the urethra. So we do not have glands within the superficial perineal pouch in male. What we have is the dot of the gland that is positioned within the deep perineal pouch. So in female, if you try to use this image down here, in the deep perineal pouch in female, we do not have glands. We only have glands located within the superficial perineal pouch. So if you try to use this image down here, this is where we have the Bartholin's gland here, also highlighted in yellow. You have one on this side and you have the other one on the other side. So you see that this gland is located on both sides of the vaginal canal, and it is specifically positioned within the superficial perineal pouch. This is where it is seen to secrete substances that helps to lubricate the internal wall of the vaginal canal. So you have the dot also releasing its secrets into the internal wall of the vaginal canal, as also highlighted here in yellow. So you see that within the superficial perineal pouch is where we have glands in female. In the deep perineal pouch, we do not have glands in female. While in the deep perineal pouch in male, we have glands. In the superficial perineal pouch in male, we do not have glands. So you should be able to establish how this presentation, of course, occur, or the placement of these different glands are seen within the deep and also the superficial perineal pouches. So let's drive further, where we'll be using this slide to explain the differences in the muscular content of the deep and also the superficial perineal pouches. So for the muscular content, so if you try to use this image up here, this is the deep perineal pouch in both the male and the female. This is the configuration that it presents. And if you look at this image that is harrowed here in white, this is the deep transverse perineal muscle. You have one on this side, you have another one on the other side. So it runs transversely within the deep perineal pouch. So this deep transverse perineal muscle is seen in both the male and also in female, and it is positioned within the deep perineal pouch. So if you try to use this lower image down here, this is the superficial perineal pouch in male. And in the superficial perineal pouch, we have the superficial transverse perineal muscle. And this is what is highlighted here at this point. We have two. We have one on this side and we have the other one on the other side. So this is how they run transversely. But this muscle is located within the superficial perineal pouch. Also in the female, if you try to use this lower image, this is where we have the superficial transverse perineal muscle. We have one on this side. We also have the other one also on the other side. Of course, it takes the same orientation as what is presented in the male. So you see that in the deep perineal pouch, we have the deep transverse perineal muscle, while in the superficial perineal pouch, we have the superficial transverse perineal muscle. And we've tried to explain how they are placed within these two pouches. Also, in addition to the deep transverse perineal muscle, in the deep perineal pouch, we have the external urethral sphincter. So let's go back to this upper image. This is where we say we have the configuration of the deep perineal pouch. We already highlighted here in this image the deep transverse perineal muscle that is highlighted here in red. In addition to the deep transverse perineal muscle, we have the external urethral sphincter. And this is what is highlighted here in gray. You see it running this course where it is seen to surround the urethra on the outside and also finally inserted laterally. So this is what is seen to be highlighted here in green. This muscle, the external urethral sphincter, in female has subsets also to contribute to the muscular content of the deep perineal pouch. So we have the sphincter uretrovaginalis, that is highlighted here in yellow. This sphincter uretrovaginalis, just as the name implies, is seen to run holding the urethra with the vagina. And of course, it is a subset of the external urethral sphincter. Then we have the second set of the external urethral sphincter in female, which is the compressor urethrae. And this is what is highlighted here in purple. You see it running through the anterior border or anterior wall of the urethra. So these two additional muscles, which include the sphincter uretrovaginalis and also the compressor urethrae, are subsets of the external urethral sphincter, and they are just seen in female. In male, the two muscles that you see within the deep perineal pouch is the deep transverse perineal muscle and also the external urethral sphincter. So it's good for us to know these muscles. While in the superficial perineal pouch, what we have include the bulb and the cora of the penis or the vestibule, and also the associated structure. So let's try and use this image to illustrate that. This is where we have the superficial perineal pouch in male. And this configuration here, we already described the superficial transverse perineal muscle, the muscles that are seen to also contribute or support the superficial transverse perineal muscle within the superficial perineal pouch include the bulb and the cora of the penis and also the associated muscle. So at the central part here, this region that is arrayed in black, where we have the bulb of the penis, remember that this region within the superficial perineal pouch will be where the penis emerges from. And where the penis emerges from is the root of the penis. So around the root of the penis, we have the bulb of the penis at the central region, while on the lateral region, we have two cura of the penis, and you have one on this side, you have the other one on the other side. So these are the structural components of the root of the penis. So these structural components of the root of the penis are erectile tissue, and they are not left open. They are seen to be padded up or covered up with muscle. So the bulb and the cura of the penis are not seen to be exposed. They are seen to be further padded up or covered with muscle. So for the bulb of the penis, we have strands of the bulbous spongiosum here highlighted in red. You have two, one on this side and the other one on the other side, of course, meeting along the midline plane. So you see this bulbous spongiosum here that is highlighted in red, covering the surface of the bulb of the penis. So we have the bulb of the penis and its associated muscle, which is the bulbous spongiosum located within the superficial perineal pouch. This same scenario is also seen in the cora of the penis that we say is erectile tissue that are located on both sides of the bulb of the penis. So you have the cora also lined with strands of muscle on both sides, and this is referred to as the ischiocavernosus. So you have the ischiocavernosus muscle also lining the cora of the penis on both sides. So you see that this erectile tissue and also its associated muscles are the structures seen within the superficial perineal pouch in male. This presentation is also seen in female. If you try to use this image down here, this is where we have the superficial perineal pouch. And this structure that is already at this point is the bulb of the vestibule. The bulb of the vestibule in female is different. If you compare the bulb of the penis and also the bulb of the vestibule, you see that the bulb of the penis is seen as a single structure that is located along the midline plane, while the bulb of the vestibule is seen to split. So you see this separation created around the bulb of the vestibule, and this separation is to create an opening for the urethra and also the vaginal canal. In male, we do not have this presentation, so there is no need for splitting the bulb of the penis to create an opening at this point. But in the female, this opening is created. So this structure that is harrowed in black on both sides is the bulb of the vestibule and also the associated muscle. And we know that the associated muscle here is the bulbous spongiosum. So you have the bulb of the vestibule already covered by the bulbous spongiosum at this point, and you see two limbs because of the separation that is created by the bulb of the vestibule. So on both lateral side, you have the cora, and this is what is arrowed here in yellow. You have two, which of course is the same presentation that is exhibited in the male superficial perineal pouch. At this point, the cora is also covered by the ischiocavernosus. So this is the kind of presentation that is exhibited in the superficial perineal pouch of both the male and the female. And the point here is for us to be able to list or highlight the different structural components in terms of muscles that are located in the deep and also the superficial perineal pouches. So let's use this slide to describe the differences in neurovascular structures seen between the deep and the superficial perineal pouches. If you look at this image here, this is where we have the deep perineal pouch that is deeply placed within the perineum, and we have the superficial perineal pouch here that is superficially positioned within the perineum. We say that the deep and the superficial perineal pouches are located within the anteriorly placed urogenital triangle, and this is what is presented here in this image. If you go behind at the posterior region, we have the anal triangle, and on both sides of the anal triangle, we have the ischioanal fossa. Around the lateral region of the ischioanal fossa, we have the pudendal canal. The pudendal canal can also be referred to as the Alcus canal. It is referred to as the pudendal canal because within this canal, we have the pudendal vessels and also nerves located within the space. So within the pudendal canal, we have the internal pudendal artery, which is a branch from the internal iliac artery. And we also have the pudendal nerve, which is one of the branches from the sacral plexus. It has these vessels emerge from the pudendal canal, are directed into the deep perineal pouch. And this is what is presented here in this image. So you see that branches from the pudendal vessels and nerves are directed into the deep perineal pouch. And at this format, you see them redirected down where they are seen to pierce the perineal membrane to gain access into the superficial perineal pouch. So you see that this collection of vessels are seen to be located within the deep perineal pouch and also the superficial perineal pouch. Considering this pattern of movement where they are directed into the deep perineal pouch and you see them turning where they are finally seen to pierce through the perineal membrane, which is the inferior fascia of the urogenital diaphragm, that is seen to inferiorly limit the deep perineal pouch. And as they pierce through this perineal membrane is when they are able to gain access into the superficial perineal pouch. So a vessel that is seen within the deep perineal pouch running through this course will also be seen within the superficial perineal pouch. But for this lecture, we are trying to establish the differences between the deep and the superficial perineal pouches. So we'll be looking at the vessels that are specific to just the deep and also the superficial perineal pouches. So if you look at another pattern, there are also some vessels that are directed from the pudendal canal, and they are seen to just pierce through the posterior region or posterior wall of the perineal membrane to gain access into the superficial perineal pouch. So this collection of vessels are not seen within the deep perineal pouch, considering this pattern of movement. So as they emerge from the pudendal canal, they are seen to just pierce through the posterior region of the perineal membrane without accessing the deep perineal pouch. So you see this collection of vessels, they are just seen within the superficial perineal pouch. An example of these vessels will include the posterior scrotal vessels and also the posterior scrotal nerve. So these vessels are not seen within the deep perineal pouch. They are only seen within the superficial perineal pouch, considering this pattern of movement. We also have a nerve that is seen to be released directly into the deep perineal pouch, and this is the dorsal nerve of the penis or the dorsal nerve of the clitoris. This nerve is seen to be released from the pudendal canal directly into the deep perineal pouch, and you see it running through before it finally pierces the anterior region of the perineal membrane to access the posterior region of the penis or the posterior region of the clitoris. So you see that the dorsal nerve of the penis or the dorsal nerve of the clitoris is limited to just the deep perineal pouch. So if we try to highlight the neurovascular structures that are seen within the deep and the superficial perineal pouch, the dorsal nerve of the penis is limited to just the deep perineal pouch, while the posterior scrotal vessels and nerve are limited to the superficial perineal pouch. Well, in addition to the superficial perineal pouch, we also have the long perineal nerve. This long perineal nerve is a branch from the posterior femoral cutaneous nerve of the thigh, which is one of the branches of the sacral plexus. So thanks for watching this video. Let's continue to stay glued to this channel.